In this video, you can test your knowledge on vital signs assessments and interpretation for nursing practice. A nurse is assessing a patient's vital signs. Which of the following findings should the nurse report to the healthcare provider immediately? Oxygen saturation 88%. A patient has a blood pressure reading of 150/94. Which of the following terms should the nurse use to describe this finding? Hypertension. Which of the following methods is considered the most accurate for measuring core body temperature? Rectal. A patient's vital signs are temperature 38.5 degrees Celsius, heart rate 95 BPM, respiratory rate 22 breaths per minute, and blood pressure 120/70. Which of the following actions should the nurse take? Administer antipyretics as prescribed. Which of the following is the most appropriate site for assessing the pulse in a patient who is in shock? Carotid. A patient has a heart rate of 110 beats per minute. Which of the following terms should the nurse use to document this finding? Tachycardia. When assessing a patient's respiratory rate, the nurse should observe the patient's chest movements while appearing to check the pulse. Which of the following pulse sites is most appropriate for assessing circulation to the foot? Dorsalis pedis pulse. A nurse is assessing a patient with suspected dehydration. Which vital sign change would the nurse expect? Decreased blood pressure. A nurse is caring for a patient with an elevated temperature. Which of the following signs would the nurse expect to find? Diaphoresis. A nurse is assessing a patient's oxygen saturation using a pulse oximeter. Which of the following oxygen saturation levels would be considered normal? (95–100%). A patient with pneumonia is being monitored for oxygen saturation. The patient's SpO2 has decreased from 95% to 89%. What should the nurse do first? Check the patient's position and respiratory status. A patient's oxygen saturation reading is consistently 92% on room air. What should the nurse consider? The patient may require supplemental oxygen. A nurse is preparing to measure orthostatic vital signs. Which of the following is the correct sequence for measuring blood pressure and pulse? Lying down, sitting, standing. Which of the following symptoms would a nurse expect to find in a patient with hypotension? Dizziness and lightheadedness. If you want to watch more videos like this, please like, subscribe, and set notifications on. See you in the next video.